Hello, I'm Jon Faine. I'm a Vice-Chancellor's Fellow here at the University of Melbourne, based at the Law School, and it's my absolute honour to welcome to this podcast, to this broadcast, Gian Luca Burci. He's the 2022 Miegunyah Distinguished Fellow and visiting Melbourne Law School and the Melbourne School of Population and Global Health after a long career with the World Health Organization, WHO. He now is an adjunct professor of international law at the Graduate Institute of International and Development Studies, Geneva, correct?
Correct.
Phew. Since 2012, and holds a number of other high-level teaching posts around the world, including here at Melbourne. And welcome.
Thank you,
Gian Luca.
John.
It's great to be able
Pleasure
to pick
to be
your
here.
brain. The pandemic has taken us into uncharted territory. The intersection between medicine and law has never been more sharply in focus. What did we get right and what did we get wrong on a global scale? And then we'll look at Australia.
Well, anecdotally, we didn't get much right, frankly. First of all, we didn't get the prevention and the preparedness right. WHO had been saying for a long time that a pandemic of a respiratory disease is not a matter of if, it's a matter of when. And in particular, disease of animal origins or zoonotic diseases. So it's not, it shouldn't have been a surprise. In particular, globalization, environmental phenomenon like climate change, loss of biodiversity, land use change, push animal and people together and create this breeding ground for what happened with COVID, in particular respiratory diseases. So,
sure, but it wasn't a if, it was a when, but it was also a, well, but maybe a long time from now.
But that's the point. What we call pandemic preparedness is like an insurance. You need to prepare at peacetime, precisely to reduce the risk of a disease going out of control. And this was not done. And I'm not so sure that there is a political will to do it now, because it's unpopular for politicians to invest heavily on something that may never materialize or may materialize on the other side of the world and not concern us. So there is a systemic problem, in particular in democracies where the cycle is fairly short, to justify big investments in something that, again, sounds very much like an insurance policy. So we didn't get that right. I think what we got right is scientific operation. With all the criticism that has been floating around, the fact remains the scientists and even pharmaceutical companies, regulatory agencies cooperated in an unprecedented way in the first few months of 2020 to identify the virus, to identify its characteristics, and immediately to start working on a vaccine, on diagnostics, on potentially antivirals, and so on. And WHO was in the middle of it. So it really coordinated clinical trials, it coordinated exchange of information. So there's an interesting almost like a divergence between the level of scientific cooperation and political cooperation that instead was quite frozen.
They speak a different language, don't they?
They do and they don't. They do because who really leapt into action were really scientists. And scientists are what we call an epistemic community. They speak the same language, they have the same interest, even though obviously they are not missionaries. They think of their own pattern, they think of their own publication, but there is a strong ethos of collaboration. In particular, where there is something new, unprecedented, kind of mysterious. Even now the science on COVID is not totally, laid out and so on. So at the same time, many of these people have clear policy connection. They're not the ivory tower scientists in a lab. They work for big companies, they work for regulatory agencies, so they have the policy in mind.
So the market forces, how important was that compared to, for instance, government regulation or the politics of international aid and
well, the market forces, that's a very interesting question, because if you look at what happened, there is, in my view, a clear imbalance between public power and private power. We've been really dominated by these big multinational pharmaceutical companies. At the same time, these companies like Pfizer, like BioNTech, have been investing heavily in these new technologies that we never heard about. Now everybody knows what mRNA, this platform technology and so on. So there had been to be fair, a lot of innovation, a lot of research, a lot of effort to create new technologies.
Yeah, they say we saved you. It wasn't government that saved you, it was pharmaceutical companies.
Yes and no, because this pharmaceutical company got a lot of public money. Go back to the US and President Trump's Operation Warp Speed. We're talking about $10, $15 billion given without asking any questions to Pfizer in particular. But it's fair to say that there had been a lot of investment, and we were lucky because the technology was mature. That's what I find so irritating when you hear all these no-vax conspiracy theories. It's a new technology, nobody's ever heard about. It's not true at all. The technology was very mature. But vaccines are not a profitable part of the pharmaceutical industry. So there had not yet been a big, spectacular disease like COVID where you could really put the technology to use. So there too, I mean, there's no black and white, there are no angels, there are no devils, but clearly there has been an imbalance in favor of the private sector that has really, to a certain extent, dominated the agenda. At the same time, we have a vaccine because the private sector had already invested, was ready to take risks also.
And it's reasonable, is it not, for the private sector, if they're investing that much money, and we're not talking insignificant sums here, we're talking enormous amounts of money, it's not unreasonable for them to want to get a return.
Yeah, absolutely. And they got quite a hefty return, I think.
But at what point do we say, okay, this is different?
Yeah.
This is about the future of humanity. This is about global survival and health.
And that's where the politics and the role of government kicks in. Because first of all, if you invest tens of billions of dollars in a company, there must be some public strings attached. For example, in terms of pricing, in terms of distribution of the vaccine, in terms of sharing patents. And the United States never did that, for example. They have a marching rights. They can really have a right to a license or to share a patent, but it wasn't done. That's a political choice.
And a mistake?
I think it's a mistake, yeah, definitely.
And likewise, when we're talking about countries bidding against each other in a, you know, I'm grateful I live in Australia. I'm grateful that Australia is rich enough to be able to secure the supplies that kept me, my family, my community safe. But I have a tinge of regret that it meant other countries couldn't do what we could do.
Yeah.
Doesn't the WHO and the United Nations more broadly have an absolutely fundamental role there in trying to balance things up?
I think WHO does very much, and WHO tried to play that role in various ways. First of all, as kind of moral leadership. I know the politicians don't exactly, start crying when Dr. Tedros talk about moral outrage, but that's leadership. That's what comes on the front page of the New York Times, there were BBC reports, and that puts pressure on politicians. The second was to create the conditions to change that narrative. And then I must say, that's also been criticized, but what we call the ACT accelerator, COVAX, these were like multi-stakeholder initiatives. They were put together in 2 months, in 2-3 months. And this was in the middle of the panic of 2020. So we shouldn't underestimate the boldness and the ambition of of those exercises.
Typically that would take how long?
Much longer. I mean, these public-private partnerships are incubated for years sometimes. Yeah. So, and you had some of these big financial partnerships like the Global Fund, you had France, you had European Union, you had the UN. You didn't have the US, you didn't have China, they still had a margin for different reasons, but you had pretty heavy calibers that stepped in and tried to create a multi-stakeholder platform to be like a one-stop shop to purchase vaccine. That was the ambition. Don't start competing with each other. Let's all buy from the same pot. And rich countries, in a way, will subsidize vaccine procurement and vaccine allocation to the poor countries. I think the idea was good. It didn't work as intended, in good part because of the rich countries, because they did double dipping, at the same time taking from COVAX and having the bilateral contract with the industry. That to me is a moral failure, frankly.
Yeah, it was, and again, you talked insurance. That was governments taking out insurance from the political fallout if they got it wrong. And we here in Australia, we were heavily invested in a Queensland experimental program which failed. Well, sorry, it didn't fail, but it ended up not being usable because of contraindications with HIV/AIDS medications and tests. But leaving that aside, governments are inevitably going to do what they think is going to make them look good at the end of the day when the history is written and the next election comes along.
And it's not illegitimate that a political leader takes care of his population first. It's easy to say, we're in this together, so don't vaccinate your people and give it to middle-income countries.
But we ended up with, I think maybe uniquely in world history, an opportunity to compare how different systems of governance managed a crisis. We had a global crisis and we could compare how a European system compared to an Anglo system, compared to a Chinese system, a Russian system, you name it, everywhere around the world. Does it cast democracy in a good light?
Yes and no. I think in the short term, not very much, because you had mature democracies like Australia, like many European countries, I think hyperventilating and acting unscientifically, because it was, in a way, politically the good thing to do politically,
prudent,
internally. And also,
in what way do you mean unscientifically? What was Australia doing that you regarded as unscientific?
Yeah, it's easy to say unscientifically. When you're acting in an emergency, it's easy, for people like us to take a step back and say,
what was done that was unscientific?
I mean, the zero COVID policy was a failure from the beginning. We had tons of evidence. The moment you relax a little bit, you have a flare-up. And then you go into these painful lockdowns that, frankly, I mean, we have enough evidence to see that that was not the right policy.
Elimination was futile. Lockdowns were doomed to fail. Is that your view?
For a short time, also lockdowns can be necessary, but not as a long-term policy. Look what happens in China. I mean, we are I don't want to say on the edge of a civil war. It will never happen. But the popular discontent is rising for top-down policy of zero COVID, which is absolutely unsustainable.
But then you've got a democracy, Australia, which tried that. China is anything but a democracy, tried it. Other countries, for a long time we were told Sweden was a much better way, just let it run.
Yeah.
But then they ended up having a public health emergency of even greater proportions. So,
well, you make mistakes. At times of emergency with a new pathogen that you don't know very well, you don't know at all actually at the beginning, mistakes are made. To me, the strength of democracy is the process that should be followed, that wasn't always followed, is the checks and balances and the counter forces that act in a democracy to correct the course. That don't happen in autocratic countries and so on. But frankly, in 2020, I think also so-called mature democracies behaved in a way that, they could have been avoided.
Who did best?
Taiwan did very well. Taiwan, I think, they had very few days of lockdowns, very few cases. Initially, South Korea seemed to be the darling of WHO,
but
then things went wrong.
So what did Taiwan do that makes them the gold standard in your view?
I think Asian countries are on the front line on many health emergencies because, after all, influenza most of the time comes from Asia. SARS came from Asia. So they had a lot of experiences in preparedness, prevention, getting the early signals that something is going wrong and so on. So they had training, they had preparedness, they had investment. And then maybe it's a political culture. There's more trust.
More compliance?
More compliance, a more compliant culture. That sounds a bit anecdotal and maybe a bit oversimplifying, but
I love anecdotes. They're much easier to understand than data.
Absolutely, me too. Otherwise, but it's fair to say. I mean, Taiwan was one of the country. If you ask, China is not a country, but let me use the term country that did best and continues to do very well.
So that's because of compliance. But what did they have compulsory masks? What did they do to contain the spread that made them the gold standard?
So I think it was, as you said, I mean, it's a careful and strategic closure of borders when necessary, protective measures. Probably they also rushed to get vaccine as soon as possible. A cocktail of measures that evidently was successful. But this I'm not sure, but I suspect that it has a good health system, a public health system. Something in my country, Italy, failed miserably. You remember in February, March 2020, harrowing scenes of military trucks full of coffins. That was a very painful moment. And that to me was not because Italy does have a bad healthcare system, but because in particular in the north, it has a highly privatized healthcare system,
yes.
where there has been lack of investment in primary healthcare. So when something like this happens, everybody rushed to the hospitals, and the hospitals were overwhelmed, and they became like super spreaders themselves. So I hope that lesson has been learned, but I'm not so optimistic.
Australia did some things we've never done before in our short national history of only 200 years or thereabouts as a modern nation. We have a magnificent history going back tens of thousands of years before colonial times. But in the modern Australia, we closed borders. We locked people in their houses. We shut schools. We shut universities. We closed down businesses, and some of those have never recovered. Do you think the public understand that the suffering was worth it in the end? Because there's a strong view in some parts, I think small, but maybe you disagree, small parts of the community who say, wasn't worth it, should have just let it run.
Easy to say. At the beginning, I think it was a very pathogenic, pretty lethal virus. So easy to say, let it run, with the benefit of hindsight. But I don't think it's a plausible explanation. I think that kind of extreme lockdowns, limitations, and so on, they make sense, and that's been WHO's gospel. They keep repeating it, even at the cost of being unpopular. That lockdowns and closure of borders and so on are not the magic bullet. They are to be applied based on a careful risk assessment, on weighing as much as possible the pros and cons, also in social economic terms. That they don't. Closing the door doesn't save you. It's an illusion. And again, the futility of the sort of prolonged zero COVID policies shows that. It buys you time at the beginning to build your own defenses and try to limit the inflow cases from outside. But it has a limited usefulness, probably. And I think WHO is correct.
Within the international legal framework, we had pandemic laws that were brought in. Pretty much every country had to tighten up their own. But we also have international human rights laws, and the two collide. So how do you strike the balance between international human rights, liberties and freedoms on the one hand, and restricting them for the pandemic on the other?
Yeah, that's an old story. I mean, human rights are not absolute. And if you look at the United Nations treaties, they are full of conditions. So you can express your views, you have freedom of assembly, but subject to limits in the protection of public interest, whether it's morals, whether it's security, whether it's health, and so on. So most human rights, except a few, like the right to life, the fundamental rights, are built with limitations for the protection of public interest. So you have individual entitlement versus the protection of the community. The point is that there is a process to follow, because otherwise it's easy, in a way, to manipulate and restrict everything in the name of interests that cannot be proven. There is a process to follow, which is not very different from what happens in other areas of international policy, based on an assessment of the risk, based on the alternative. What you should do should be the least intrusive to achieve the public aim, and so on. And again, it's easy to pontificate 2 years after the fact. At times of emergency, I think that countries have a lot of discretion and should be given deference for taking measures that after the fact may seem disproportionate, may seem excessive, and so on. So I think human rights suffered because after the first initial shock, I think countries had the responsibility of taking a step back and saying, is it justified that we continue with these measures? Should they be reconsidered? And in particular, should there be a more inclusive process? I mean, my country, Italy, the government didn't know what to do. Italy did not have a clear emergency law. And so they invented decrees of the prime minister, which is something unconstitutional, probably. The best thing they could think about. And I think to a certain extent is still the way in which measures are brought in 2 years later. So again, I would distinguish moment of panic and emergency, when you need to put yourself in the shoes of a political leader. But then I think there is an obligation, legal, political, moral, to try to take a step back and in a way, fine-tune, change, revise, rethink the measures you take based on a science which, at least in developed countries, should not be in short supply, and also avoiding easy politicization. That, to me, didn't happen enough. And that, to me, what I was saying about sometimes this prolonged lockdown were not necessarily necessary and legitimate. Human rights is not just liberties. Human rights is also social and economic rights. And that, to me, is the unsung victim, is not being able to access a hospital. I mean, I live in Geneva. Switzerland is a rich, democratic, well-functioning country. But in 2020, if I had a cancer, I would have had more chances to die than if I had COVID, because the hospital was sealed. Was that justified? Was that legitimate? So also that side of human rights, I think, suffered quite a lot. And that, I think, requires even more thinking, because it's, in a way, almost conceptually a bit easier to counterpose the individual freedoms and these public measures. But what about the loss of job? What about not going to school? What about the absence of a safety net?
Mental health, anxiety, all of those things that are through the roof.
And that I'm not sure that there has been enough reflection on what should be done next time.
Is it partly a failure of the World Health Organization that globally we saw such a surge in vaccine skepticism and the anti-vax movement?
I think it's a bit unfair to scapegoat WHO. WHO, in a way, has been very vocal in trying to give, scientific evidence, try to give the message.
Sure, but it didn't get across to everybody, did it?
But that's not necessarily the fault of WHO. I think there are many factors. I mean, scientific skepticism is nothing new. Vaccine are a particularly sensitive topic when you talk about scientific skepticism. I mean,
it used to be this big. Now it's this big.
Yeah. Why? Because a perfect storm of politicization of a bad moment for a pandemic like this, and the temptation to politicize and politicize the message for easy political gains was evident, and science was a victim in a way.
But is it not fair to say to science, lift your game? You have to do better at explaining why this works and why it matters.
Yeah, definitely. I'm not sure that would have made a huge difference, but it could have made some difference. But you're right, I mean, maybe skepticism was like this. But I do remember when I was a child in Italy in the 60s, and we had polio vaccination. I still clearly remember on TV, mothers saying, this is my child, I decide what to do, and I don't believe in this vaccine. Maybe the poor child got polio and is crippled for life. So it's nothing new, but it exploded with COVID, I think. And that too, I think, requires a big reflection. I mean, to be fair, WHO did what it could, but international organizations are not the best communicators.
No.
We don't master social media. Our communication is filtered through many layers of politics.
There's no creativity. It's too bureaucratic.
Yeah, so they're not the best communicator, but I mean, the arguments were there, and maybe many governments should have been more, and the media, I think, should have been more aggressive and more responsible. I think the media have a big responsibility.
We could start another whole conversation about just that, but I've only got a few minutes left, and I want to talk about the cultural clash between doctors and lawyers.
Was there a cultural clash?
They don't trust each other and sometimes don't like each other, and they don't think in the same ways. So the lawyers, just here in Australia, the lawyers were saying you have to do this, this and this, and you can't do that, you can't do that. And the doctors were saying, no, we have to do this, we have to do that, we have to do the other. In a public health emergency, who should prevail?
Neither. Good political leaders should prevail. That should mediate between the language of law and the language of science. It's true that there are different communities. I think they come closer in several respects. I think HIV/AIDS, for example, brought medical doctors, political leaders, and lawyers closer because of the human rights angle, because of the access to medicine angle, and so on. I think COVID is another defining moment that can bring to communities to understand the complementarity. But in the end, I mean, I think that should be, again, serious, mature political leaders that try to find the balance between the legal discourse, the obligations, and so on, and the voice of science. But it's true that there are two fairly different communities that have difficulty in communicating. I was 11 years the legal counsel of WHO, and to me the biggest challenge was to give legal advice to doctors. They sort of glazed after about 30 seconds, and they'd always be suspicious of this lawyer talking the heavy jargon and so on. And it wasn't necessarily the case. So that was, but then you learn to communicate. You learn to be conscious of the difference in mentality, the difference in mindset, in background, and so on. And when you do that, it allows more communication, I think.
So Gian Luca, how important is it to have some sort of international framework, legal framework, when you're dealing with a pandemic like COVID turned out to be?
I think it's very important, and that's something that is, I think, underappreciated. And that, in a way, is the core, the historical core of what we call international health law. And it's nothing new. European states started negotiating treaties in the second half of the 19th century. Why? Because bugs don't stop at borders, and because pathogens travel with people, with means of transport, and with trade. So there is like a, in a way, inbuilt international dimension of epidemics and so on. So you do need common rules to cooperate, to avoid that disease, the protection of health sort of stops trade, so to reach a certain balance. So the need for legal framework has been evident for more than a century. The point is, how do you, we seem always to be chasing after pathogens, and the bug
takes us back to the beginning, which is you have to prepare because you can't negotiate that legal framework in the middle of a crisis.
Exactly. And so the main existing legal framework is what we call the International Health Regulations, adopted by WHO, revised several times. Probably, I mean, most people must have heard about them during COVID because they were criticized all the time. And I think they're a fairly modern instrument that takes into account the fact that we don't know what the next epidemic will be. And so rather than listing diseases, we need a framework to be prepared and to have conditions for cooperation. And I confess my bias because when I was in WHO, I was in the team that revised the international health regulations, and they were negotiated into what they are today. And I think that they are an important piece of legislation where more or less almost 200 countries are party to it. So there are some common bases for cooperation, for a minimum of things to do, like in your health system, in notifying WHO if there is a suspicious outbreak of the disease.
Sure, but any law is only as good as when it's enforced, and if you don't have compliance and there's no mechanism for enforcing, what use is an international framework?
I think there's too much emphasis on enforcement. With COVID, many people are saying, these instruments are toothless, there's no sanctions, there's no enforcement, and so on. But if you look at the reality of international law, treaties, instruments that have these top-down punishing enforcement are the absolute exception. Because after all, the world is made of states that can be politically different, but legally they're all the same. And so international law is implemented, compliance comes in subtler ways. And in particular, you need to build incentives for compliance.
Right. And it's better than nothing, of course.
Yeah, better than nothing. There was a famous American professor that said most states comply with most international obligations most of the time. And I think it's very correct. So anyway, the international health regulation showed the limit with COVID. And so many countries, in particular European countries, they said we need new rules to basically pick up where the international health regulations are stopping. And so WHO has now started, I think, pretty painful process of negotiating a new pandemic treaty. It just started, and as you may know, when you start these negotiations, all the countries put the little piece in the pot. Either the bargaining chip or because it's an important priority, we don't know yet. This treaty should be negotiated and adopted in 2 years. I think it's very optimistic, but that's, you need that kind of pressure to do something. And there are 2 or 3 things that the treaty, in my view, should do. One is to address the question of zoonosis, which is totally unregulated in my view. You will never stop them, but you can reduce the risk of this constant spillover from animal to humans. The second is to downstream, at least put the basis for a better system of research and development and allocation of medicines, vaccine, and diagnostics and so on, to avoid what we have seen in the last 2 years. And that's an absolute non-negotiable request of many low and middle-income countries. We don't even sit at the table unless we have credible guarantees in a treaty with that level of commitment that there will be a better system of innovation and access that there has been until now. So there are gaps, I think, that requires better rules. Again, the rules don't implement themselves. You need political commitment. You need a number of things that would be, I think, too complex to summarize now. But I think the commitment is there. Even the United States, they were very reluctant at the beginning. When you talk about the treaty, they immediately get, this.
Yeah, well, they never want anyone telling them what they should do. It's regarded as their
but
sovereign
now they're
right.
engaged. They're engaged because they don't want to be isolated, because they see an advantage in being in the game. A friend of mine who's an American lawyer in Washington says typically the US negotiate fiercely. They don't ratify, but then they try to support it from outside. Yeah. And we have that over and over and over. So I expect the US to do the same. But it's good that they're engaged, because they show at least the value of this exercise that should lead to a set of new international rules that should plug, I think, some evident holes that are partly responsible for where we are.
I hope Melbourne is kind to you, Gian Luca. It's wonderful to be able to pick your brains for the purposes of the university wanting to understand the complexity and the nuance of the work that you've been doing over your whole career, although we've very much concentrated on just the last few years. But thank you very much on behalf of Melbourne Law School and the whole of the University of Melbourne. It's wonderful to have you here, and thank you for your time today.
Thank you for inviting me. It's been a pleasure.